Rula, you may start that. Thank you.
Okay. Good morning, good afternoon, and good evening, everyone, wherever you are. And welcome to our webinar entitled Outdoor and Indoor Air Pollution, Short and Long-Term Impacts on Health. I am Rula Darwish, professor at School of Pharmacy, the University of Jordan, co-lead for CPD Strategies Workforce Development Hub, and executive committee member, FIP Academic Section. Also, I am the chair of CPD Committee in Jordan Pharmaceutical Association. For some housekeeping. Next slide, thank you. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website, and you may ask questions using the question box provided. You are also welcome to provide feedback to webinar at FIP.org, and we encourage you to become a member of the FIP so as to transform the role of pharmacists. Thank you. Next slide. FIP would like to thank the Clean Breathing Institute for supporting this online event. Now, just to take a look at the program today, we're going to have an introduction followed by a video telling the story. It's going to include WHO Breathe Live, and this is going to concentrate on how air pollution impacts your body. Also, we have another short video that's going to be on WHO air pollution and health. How will our children continue to breathe? Then we're going to have two distinctive talks from our professors. Professor Gary Young, who's going to talk about the short and long-term impacts of air pollution on health, concentrating on types of indoor and outdoor pollutants, also impact of quality of life and impact on health, respiratory, immune system, and so on. The other talk will be from Professor Fan Chang, is going to be entitled Prevention and Management of the Impact of Indoor and Outdoor Air Pollution on Health, concentrating on clinical management, pharmacological and non-pharmacological therapies, prevention care or measures, and practical tips. After that, we're going to have 25 minutes for panel discussion and Q&A, and then we'll have a wrap up in 5 minutes. So, air pollution and its impact on respiratory health is a growing problem. In 2019, the World Health Organization listed air pollution and climate change as one of the top 10 threats to global health. According to WHO, air pollution is the greatest environment risk to health, with 9 out of 10 people breathing in polluted air every day. Thus, there is an urgent need for all air pollution not only to be addressed from its devastating effect on the environment and global warming, but also for the direct threat it poses to the health of individuals and communities. Pharmacists, particularly those practicing in community settings, have clear roles as both medicine experts and trusted messengers. Alongside health system and other healthcare professionals can work in synergy to mitigate the impact of air pollution on people's health and quality of life. Recent findings from FIP 2020 survey, undertaken in collaboration with the Clean Breathing Institute on air pollution, with response from 62 countries and territories, supported pharmacists' expanding role and need for associated services. Furthermore, the International Pharmaceutical Federation and JSK scientific initiatives, together with the Clean Breathing Institute, have gathered a panel of experts to participate in webinars to explore the multiple ways air pollution can be harmful to health, as well as highlighting the preventative, clinical, pharmacological, and non-pharmacological therapies available. A better understanding of air pollution and health is vital to allow pharmacists to develop effective interventions and services to address this growing problem. Actually, tackling air pollution as a major health threat cannot be achieved without recognizing pharmacists' responsibility and pharmacy position in minimizing pharmaceutical adverse effects on the environment. This has been supported by FIP and advocated by a statement of policy on environmentally sustainable pharmacy practice, green pharmacy. Our webinar today, entitled Outdoors and Indoor Air Pollution, Short and Long-Term Impact on Health, is going to concentrate on air pollution and is going to address this problem not only as an environmental and ecological issue, but also as a direct threat to human health. It will lead to a better understanding in the multiple ways in which air pollution can be harmful and how pharmacists can address this global threat. Our overall aim is to support pharmacists to play a proactive role in respiratory management of the health impact of air pollution by helping to address their practice and education needs to enable them to provide better patient advice and care. So our learning objective is to identify the ways in which outdoor and indoor air pollution impacts on human health, understand the short and long-term impact of air pollution on health, understand clinical, pharmacological, and non-pharmacological treatments, including preventative measures available to minimize impact of air pollution on health, and illustrate how air pollution might change the type of profession service offered by the pharmacy. Next slide, please. Now we're going to have the short videos. The first one, please, is going to be on air pollution.
It lurks all around us, preying on the young and old. It slips unnoticed past your defenses and assaults your lungs, heart, and brain. Its deadliest weapons are invisible, poisonous particles that can be as small as a molecule. With every breath, they break through your lungs' protective barriers. There, they trigger inflammation as your system tries desperately to fight back. But these tiny intruders penetrate those defenses, lodging toxic compounds even deeper, sowing the seeds of cancer. They slide straight into your bloodstream, sabotaging your entire body. They inflame and constrict your blood vessels, increasing blood pressure until, one day, causing a stroke. The particle prowlers dislodge fatty plaque that may have built up from your diet. They weave clots that can be deadly blockers of blood flow to your heart or brain. With each new case of heart attack, stroke, lung disease, or cancer, air pollution adds another life to its hit list. Let's stop this invisible killer.
Children are our future. Societies that help their children to achieve their full potential thrive and grow economically. That's why it's so important to protect our children from one of the greatest dangers they face: the toxins and particles in polluted air. Children, our future, crave clean air so they can survive and thrive. Our future craves clean air, but air pollution is increasing. We are facing an emergency. 9 out of 10 children do not breathe safe air. Children are closer to the ground, to car exhausts and indoor smoke. They breathe faster than adults, taking in more of the polluted air. And their developing bodies are more likely to be damaged by the toxins in the air. Every year, 600,000 children die from breathing polluted air. Before a baby takes her first breath, she's being harmed by the toxins her mother is inhaling. Half of all deaths from lung infection in young children in lower middle income countries are due to air pollution. If that baby survives childhood, the daily damage done to her brain, lungs, heart will limit her chances of growing into a healthy, productive adult. Cognitive damage, lowering of a child's ability to learn, means children exposed to air pollution will struggle at school and fail to reach their full potential. Terrible damage has been done, but it is still not too late to change. By prescribing clean air for children, policymakers can save lives and protect them from the lifelong effects of air pollution exposure. We all have a role to play. Activists, experts, economic and political leaders, and individuals can all take steps to better manage waste, change the way we travel, monitor air quality, and regulate production of pollutants, among many other potential actions. But we have no time to waste. We can and we must act now.
Dios salito y carota para chumel as ninjas and the magasian to
Thank you. We definitely have no time to waste. So now we're going to have our first speaker, Professor Gary Young. Professor Young obtained his undergraduate medical education from the University of Alberta, Canada. He subsequently received fellowship training at the Children's Hospital of British Columbia, Canada, and visiting fellowship at the Children's Hospital at Munich, Germany. Dr. Young's main research interests are treatment, control, and prevention of allergic conditions, including asthma, food allergy, wheezing disorder, and respiratory infections in children. He has served on the board of directors of the Global Initiative for Asthma. He has also been a member of board of directors of the World Allergy Organization since 2019. Now, Professor Young is in the Department of Pediatrics from Faculty of Medicine, Chinese University of Hong Kong. Professor Young, the floor is yours. And you have 25 minutes, please, to give us the short and long-term impacts of air pollution on health.
Great, thank you, Professor Darwish. And I'm very glad to have this opportunity to discuss with you the short and long-term impacts of air pollution on health. Next slide, please. Well, we need to figure out, why we should care about air pollution. In the previous two videos, you probably get a glimpse of the potential tragic problems related to air pollution. So we also need to understand what are the components of air pollutants. And in order to minimize these pollutants, we need to know how and where do these pollutants come from? And how do these pollutants affect our health? Next slide. Perhaps in the last 100 years, this was one of the most dramatic examples of how air pollution can affect humans. This happened in 1952, the very famous incidents of the London smog. During that time, the air quality and the type of industrial pollution and also pollution from traffic were very heavy. And coupled with climatic conditions, when there was a high pressure system with very little wind, there was tremendous accumulation of pollutant Now, as you can see here with the measurements of sulfur dioxide, back then the type of fuel used is not, it's heavily loaded with sulfur. So burning of those fuel result in the production of sulfur dioxide, one of the more detrimental components of the older type of pollution. As you can see here in early December, when there was rise in SO2, sulfur dioxide, you can see the weekly mortality in the city basically increase in parallel to the increase of sulfur dioxide. So we know air pollution kills people. Next slide. Next. Now, as you can see here from the WHO summarizing the ambient air pollution across the world in this diagram showing the very fine particle PM 2.5, less than 2.5 micron in aerodynamic diameter. As you can see here, all across Asia Pacific, as well as a big part of Africa, Eastern Europe, and large part of South America. The level is extremely high, way above the WHO standard of 10. Next slide. So the WHO estimates the number of premature death every year. The estimate range around 7 to 9 million every year. And of course, one is not surprised that you can see the majority of these deaths are in the heavily polluted area, including the Asia Pacific region, as well as Middle East, and also large part of Africa. But if you look at the Americas as well as Europe, it's over 500,000 deaths too in the European region. So it's a big number of lives that we lost every year due to air pollution. Next. Now, if one look at the various type of problems leading to death in relation to air pollution, as you can see here from this article published in Lancet by Cohen and his colleagues, you can see the total number of deaths attributable just to PM 2.5 alone increased gradually since 1990s. And that includes the death related to lower respiratory tract infection, namely mostly pneumonia, and cerebral vascular disease like strokes, and various types of cancers affecting the respiratory system, heart attacks, as well as chronic obstructive lung disease. Next slide. And when we look at the various components of air pollutant, there are the gaseous content, such as the various oxides of nitrogen, such as nitrogen dioxide, we mentioned earlier, particularly from fuel which generate from a lot of sulfur-containing fuel, sulfur dioxide, and ozone, to a lesser extent, carbon monoxide. And there are various types of particles of varying size, from big to intermediate to small, as well as particles generated from the diesel combustion engine. Next. When one look at the size, now here is the comparison to the size of a human hair, as well as compared to the size of fine beach sand. So if one look at the human hair, approximately, depending on where you measure, is anywhere around 50 to 70 micrometer or microns in diameter. So when we traditionally look at the particle size, very often we mention, for example, PM10, which is particle which has aerodynamic diameter of 10 microns, which below the size of this, in general, these particles can get inside our airway. And the very small ones, PM 2.5, are those that can go deep down into our airway to the alveoli, as well as the terminal bronchioles, which these particles can be taken up directly and get into our bloodstream. Next. So when one look at the respiratory tract, starting from the nasopharynx, the oropharynx, and then the trachea, and with approximately 23 divisions, one will go into the intermediate airways such as the bronchus and bronchioles, and the terminal alveolar duct, and then the alveoli, where gases exchange occur. So the smaller the particle, the deeper it can penetrate and get absorbed into the bloodstream and cause the subsequent cardiovascular problems. Next slide. So here this cartoon illustrates the relationship of particle size and where the particles get impact. So for relatively large particles, from 5 to 10 microns, a lot of them will be deposited in our upper airway. For example, the pollens characteristically, the large pollen particle characteristically would deposit in the upper airway. And that's why for pollen allergic individual, and during the pollen season, they would develop severe allergic rhinitis symptom with all the pollens deposited in the upper airway. For the smaller one, for example, 2.5 to around 5, they get further down to the intermediate airways, and the really small one and the gases molecule, they will get directly deep down into the alveoli, where they can be absorbed and also penetrate into our bloodstreams. Next slide. So if we look at the pollutants as well as the origin, first, let's look at the particular matters. The majority of the PM particles can exist from natural environments, such as when there are sandstorms, for those communities who live close to deserts. But in the cities and as well in the rural area, the major source of these particles are from vehicle emissions, as well as from construction site, as well as factory, depending on what type of fuels they burn, and also with indoor biomass burning. Sulfur dioxide used to be a major problem, but there are a lot of regulation nowadays that the sulfur content in the fuel is extremely low. That helps to reduce the atmospheric or environmental sulfur dioxide concentration. But nitrogen oxides are a major problem because they tend to be generated from burning of fuel at very high temperature. So characteristically from motor vehicle, as well as indoor, very often from gas stove. And ozone is a very interesting pollutant because the production or generation of ozone requires the oxides of nitrogen as well as volatile organic compound from various types of solvent. On top of that, sunlight is required to generate the production of the ozone. Next slide. So I mentioned here, okay, in the typical, for example, in California with lots of sunlight, ozone is a major pollutant when you have lots of motor vehicle and lots of sunlight. With that, along with the VOC, ozone is being generated, and it's highly irritating to the airways. Next slide. Now, of course, on top of the various type of traffic, as well as factories in modern society, similar air pollutant can also be generated inside the house and in the rural homes. Next slide. Now, we may not think of it because very often in the so-called modern home, you don't see the small, you don't see the large particles within a housing environment. But in fact, within a house, there are many different sources of generation of pollution. For example, in the kitchen, you have a gas stove and high heat burning. In fact, in poorly ventilated kitchen, once you turn on the gas stove, then nitric oxide's level increase dramatically. And also, in a modern home, there are various types of appliances and furniture and use of cleanser, and all these painting, all these will release various types of volatile organic compound, which would irritate the airway. And on top of that, within a home, such as in a very moist environment with high humidity, such as in the bathroom, the moisture plus the various type of molds would also generate types of indoor larger particles pollutant that would have detrimental effect to our health. Next slide. So now there have been a lot of research looking at the indoor air pollutant produced by gas cooking. In fact, a nice comparative study comparing use of relatively clean cooking, such as from electricity or for induction cooking, compared to the use of gas stove. Gas stove would result in marked increase in nitric oxides, and these gas cannot be seen. And comparative study looking at asthmatic living in these environments, very often with the increase at NO2, it tends to result in increase in the severity and difficulty in control of the asthmatic, as well as use of more asthma medication from in these individuals. Next slide. Now, we mentioned about in the developed countries, we have pollutants coming from both from outside, for example, apartment or home live close to highway traffic, or pollutant generate from indoor sources such as gas stove, tobacco smoke, and various type of volatile organic solvent. And we must remember, many of these pollutants actually are not visible. So they are there and we are breathing in these pollutants, generating detrimental health effects. Next slide. Now we will look at the various short-term and long-term effect of these pollutants. Now I've listed out here several important systems that can be significantly affected. Now, of course, the respiratory system and the cardiovascular system are the most important system affected by the pollutant. Now, a lot of these particles, they can have an oxidizing effect or elicit airway inflammation or couple with pollutant plus allergen, which will stimulate inflammation of the airway. And that's why asthmatic patients are particularly prone to these pollutants, as well as patients with COPD. Now, air pollution has now been classified as carcinogen by the World Health Organization because it actually would result in changes in the cell growth and result in cancer development of the lung. And of course, in developing countries, a lot of children, as we have heard from the video earlier, pneumonia in children, very often a big percentage in developing countries are related to air pollution. The long-term effect, there has been a lot of study looking at the growth of the lung as well as lung function gain in children, and high level of pollution will result in poor lung growth, limiting the pulmonary capacity of a child when he grows up. Cardiovascular system, we mentioned earlier, these small particles would get right into the bloodstream and stimulate inflammation as well as clotting. And that's why it leads to development of heart attack and stroke. And there are other systems also affected when a pregnant woman is exposed to high level of pollutant. The infant, the newborns, tend to have a lower birth weight and various types of pharyngeal cancers. And also air pollution has been linked to a variety of psychiatric illnesses. Next slide. Now, how does the air pollutant affect particular airway inflammation and precipitation of more severe airway inflammation? Now, because the air pollution would interact with our immune system, our immune system broadly classified into two big broad groups. One is the innate immunity, the immune capability that we were born with. On the other hand, the adaptive immunity. We have the two major cell types, the B cells and the T cells, which produce antibodies, and the T cells more with cytotoxicity. While all these cellular types as well as the antibody, they're usually there to protect us from infection. But somehow many of these air pollutants would activate these inflammatory cells, would result in a higher level of unnecessary inflammation, leading to airway problems and subsequent such as subsequent asthma exacerbation. Next slide, please. The more recent studies have also linked the development of a variety of psychiatric illness, such as Alzheimer's disease, Parkinson's disease, autism, multiple sclerosis, as well as depression and anxiety. What happened is these pollutants can get in the bloodstreams and then circulate up into the central nervous system. And there are very good animal models showing that leads to premature neuronal degeneration, loss of the synapse, and premature neuronal death, leading to a variety of neuropsychiatric problems. Next slide. Now, when one look at the pyramid of effects from air pollution, of course, the obvious number is how many people develop asthma attacks and required admission to the hospital, and how many people die from heart attack. But in between, there are also other not so readily visible effects. We'll see more patients going to the hospital, going to emergency, or going to the doctor to have a visit because of poor control of, very often, their lung disease such as asthma, or they may be requiring more self-medication to control the symptoms at home, or there are, for younger children with some airway problem, when there is a higher level of pollution, they realize their exercise tolerance or ability to exercise would be reduced. So the effect can be very broad, affecting a lot of people, and also the more severe to a smaller percentage of the individuals. Next slide. Now, one acute effect, the very famous Oxford Street study was Professor Fan Chong is one of the senior investigators. What the researcher did was they took a group of adult asthmatics and let them walk around for 2 hours in a relatively cleaner environment, Hyde Park in central London. And then they also had, in comparison, they also walk in Oxford, the shopping street in London with lots of traffic, with very high level of pollutant. And one can see, after walking just 1 hour, there was dramatic drop in the FEV1, and you can see after the 2 hours, the effect on the forced expiratory volume, the lung function drops and stay low for at least 7 to 8 hours. Even we still see some effect, at 22 hours after the start of the exposure. Next slide. Now, in terms of looking at lung development, lung function development in children, perhaps one of the best studies was from this study published in the New England Journal of Medicine, looking at 5 different communities in California. And as you can see here, over the years, from 1995 to 2010, they have rigorous restriction in terms of traffic and also the type of fuel that they use. So you see all across the board here over that, 5 years, 15 years, you see a drop in the air pollutant, whether it's nitrogen dioxide, ozone, or PM10 or PM2.5. And also, they follow a group of children throughout these years. Next slide. And when they follow the lung function, one can see that in different community, they manage to reduce the nitrogen dioxide, for example here, from 40 down to more closer to 25 to 20. One can see the forced vital capacity growth in children of these communities. You can see an increase in the lung function growth, forced vital capacity growth. So as you can see, once you control air pollution, actually the lung function will actually grow or grow better. Gain of the lung function with time will be better. Next slide. And when one look at the adverse outcome on asthmatic, there has been hundreds of studies looking at the relationship between air pollution and hospitalization rate due to asthma. And when there is a rise in various types of pollutant, very often subsequently within days, you will see increase in hospitalization rate, increase in admission to accident and emergency department, and even increase in mortality rate, as well as reduced lung function and increased use of medication in asthmatic. Next slide. So in conclusion, there are many different components of air pollutant, and most of the adverse effects are related to respiratory and cardiovascular system, but it's not limited to those 2 systems. As we have seen, it affects the fetal growth, it affects the central nervous system, and there, particularly for children, the major adverse effect on lung function impairment. And of course, we see large number of excess deaths in both developed and developing countries. And definitely, we need measures to reduce air pollution and devise ways to protect those who are at risk. Next slide. And thank you very much for your attention.
Professor Young, thank you very much for this comprehensive talk on pollutant, their origin, their components, and their effect on health and immune system, both short and long-term impact. And also, you discussed the effect of implementing control measures, and this is very interesting. Dear audience, just a reminder, we will have 30 minutes at the end of this webinar to answer your questions. Could you please write your questions in the Q&A if possible? Thank you very much. Now we'll have Professor Fang Chang from Faculty of Medicine, National Heart and Lung Institute in Imperial College London. Professor Chang is Professor of Respiratory Medicine at the National Heart and Lung Institute, Imperial College London, and respiratory physician at the Royal Brompton and Harfield NHS Foundation Trust, London. He is senior investigator for the UK National Institute for Health Research. He is on the scientific committee of the Clean Breathing Institute. Professor Chang specializes on the treatment of asthma and chronic obstructive pulmonary diseases and on conditions underlying chronic cough also. He studies how the lungs respond to external agents such as pollutants and infections and the airway mucosal interface. Professor Chang currently leads research projects on precision medicine in severe asthma, on the integration of the effects of exposure to pollution at an individual level, and on the role of eosinophils in airway diseases. The title of the talk today is Prevention and Management of the Impact of Indoor and Outdoor Air Pollution on Respiratory Health and Beyond. Professor Chang, the floor is yours. You have 25 minutes to give us this precious information.
Thank you very much, Professor Darwish. It is a pleasure for me to address this FIP TCBI meeting, and it gives me great pleasure to talk about what we can do and what we can advise the general public about how to limit or prevent being impacted by the effects of indoor and outdoor airway pollution on health, which we have heard from Professor Wong earlier today. So on my first slide, I want to emphasize that pollution, in fact, affects everyone. In fact, affects all age group, from your start in life in the womb down to the older age person. And of course, we do recognize that certain categories of those ages are more susceptible to the effects of pollution, but I'll come to that towards the end of my talk. But this slide really shows that all the effects that one can get, the sort of chronic disease that one can get from chronic exposure to pollution, and particularly effects on the lungs, and the effect on the lungs, obviously, at an earlier age in the womb or as a baby or a child. The effect on the lungs would be to retard growth of the lung. And I just want to remind everyone that the lungs only get to its final stage when you are around about adolescence. So it takes between age 0 to age around 16, 17, or 18 for your lungs to grow fully. And you can see that this was illustrated by the study that was shown by Dr. Wong, where the growth of the lungs was impaired in kids who were exposed to high levels of pollution. But of course, asthma is a very important disease that we think is now linked to airway pollution. There is increasing evidence that now this is that pollution is a major cause of it. Not only that it worsens people with asthma, but it may well be a cause of asthma. And then as you grow older, there are other effects of pollution, which I will not address, but you can see diabetes, heart attacks, and even obesity has now been implicated as a side effect or as an outcome of exposure to pollution. And on my next slide, I want to directly come to the issue of what are the sort of symptoms that people might come and ask advice from a health professional. So I think it's important to recognize that there are those symptoms that are associated with exposure to air pollution. And a lot of the symptoms, obviously, are related to effects of pollution on the upper airways, particularly, and also of the lower airways. And again, rationalizing from what Dr. Wong has mentioned, So all the large particles that get stuck up in the upper airway, in the nose, and up in the throat, will obviously cause those symptoms that are shown here: the throat clearing, sore throat, rhinitis, chronic cough, and to some extent some chronic sputum production. But of course, we know that the finer particles will go directly down deep into the lungs, and these may start to cause things like chronic sputum production, chest tightness, shortness of breath, wheeze, and chest infections. And of course, all these symptoms may not be necessarily just be on the basis of the pollutant itself, but maybe the effect of pollutant activating, for example, allergies, or causing the onset of infections. For example, we know very well that if you live in a polluted area and during the winter season, you're more likely to develop a cold than if you lived in a less polluted region. There are other related symptoms that I won't go into in great detail, but these may also indicate the effect of pollution. So symptoms related to stress hormones, and these include headache, tachycardia. Raised blood pressure also has been implicated now as a potential problem from exposure to pollution, and obviously itchy, watery eyes, and having a metallic taste. The next slide really emphasizes the point that you will get a lot of symptoms in those who got existing pulmonary disease, such as asthma or bronchitis or COPD. And in those conditions, you might well get exacerbations or worsening of the disease. And as I mentioned, the pollution will, particularly in these groups of patients, will favor the appearance of upper respiratory tract infections with viruses or bacteria, and that also applies to the lower respiratory tract. And of course, if you have asthma and you have to an area where there's high level of pollution, your symptoms might get worse. And we know very well that whenever there is a spike of pollution within the next 24 to 48 hours, our hospitals or our doctors get called because the asthmatics are getting what we call exacerbations or attack of asthma, and also obviously worsening upper airway symptoms, and also this worsening of allergy symptoms. And again, this interaction between pollution and pollen and the deposition of the airway do augment symptoms, for example, occurring with hay fever. So when these people or these people who have asthma and allergies present with those symptoms and is a worsening of those symptoms, what can we do? I mean, I think it is, of course, important to make sure that these symptoms are actually related to air pollution. And in fact, in most cases, it's probably not difficult to ascertain this in relationship to levels of air pollution. And I think this is very important to recognize. And it's also very important for people to recognize when the levels of air pollution in their surroundings is increased. And I will come to that a bit later. So obviously we need to know whether there's any predisposing disease, as I mentioned. And from the symptomatic consideration of these symptoms, I think there's still much to try and learn. But I mentioned some categories of medications that are available, and some of them are available over the counter that could be considered. Obviously, antitussives, antihistamines, anti-inflammatory, and also nasal saline sprays or wash, which I'll come to in a minute. But I mentioned those categories of medication, not necessarily that they will necessarily work in those conditions, but we have those, and it's always good to try them. And obviously, they need to be used under the correct circumstances. And I just want to mention, for example, for the level of antitussive, I think we have an issue here because the currently available over-the-counter antitussives may not necessarily be the best approach for cough during from pollution. Obviously, asthma treatments are available for those who have an asthma exacerbation or an increase in asthma symptoms, and of course, these people need to be referred to their GP or to the healthcare person for further treatments of the asthma or COPD and so on. Next slide. So the role of saline nasal sprays, I think, or drops in nasal hygiene has been, I think, a bit underused. And obviously, those saline nasal sprays are going to, in a way, be part of a nasal hygiene to clean your upper airway, your nose, from pollutants, particularly the larger particle pollutants that have been deposited in the upper airway, and can help to prevent those upper airway symptoms that often accompany exposure to pollution. So it's a nasal hygiene which has been shown to clear the upper airway and improve nasal congestion and prevent allergies and sinus problems and improve mucociliary clearance. And I think for those reasons, I think it is a reasonable thing to do when people who clearly have symptoms related to the upper airways. And so on my next slide, I'm going now to change a bit of emphasis. I think the next part of my talk is going to emphasize on what are the sort of strategies that can be done at a personal level. And as you can see, in terms of pharmacological approach to treating those symptoms, we are, I think, still limited, and there's still a lot of work that needs to be done to find good methods of treating those symptoms. So at the moment, I think that one of the ways in which we can tackle at a personal level in terms of minimizing the effects of air pollution is obviously preventing exposure. Exposure both in the home and also outside the home. And what I'm going to present to you is, in fact, the fruit of work of colleagues under the auspices of the TCBI, where we reviewed the literature concerning what are those strategies that we can do. In fact, this is actually an evidence-based approach that we took. So on next slide, please. So the first part is how can we minimize personal exposure to ambient and household air pollution? So there are about 6 different approaches that I will talk about. I will go through them fairly quickly because obviously you should read this paper that we published, which was published last year. And overall, you will see that the evidence that on which those recommendations are based are really at a sort of lower grade. I mean, we would have liked to have seen very good studies that have shown the benefits of those measures that I'm going to mention, but we don't have that yet. And most of the evidence is based on small studies. But some of the recommendation you would see probably does make common sense also. So first of all, obviously, use of face masks, and we've been very impressed with this recent COVID, with the current COVID pandemic, how certain populations can easily adapt to wearing face masks, while other populations are less easily convinced about using face masks. And in the case of pollution, one of the issues here is that we need to be using face masks that prevent those finer particles to be inhaled into the lungs, because these fine particles are the ones that get into the lungs and get absorbed in the circulation and causes problems in the rest of the body. So when we use face masks, we need to be using face masks that are close-fitting N95 face masks, as recommended by various authorities. And particularly, I think people with chronic respiratory disease or cardiac or other conditions possibly should use this more often when there are high levels of air pollution. But then this can make breathing difficult in those people who also suffer from shortness of breath. But the important point here is that they need to be tight-fitting masks to control. And the better masks are those that also contains, for example, carbon particles that can inactivate particularly those gases pollutants. Next slide, please. On the second recommendation, which is very obvious, which is to shift from motorized to active transport whenever possible. I don't. This is a very obvious type of recommendation, and that also would encourage exercise. But there need to be the framework for this to happen, and that is where, for example, our organization of cities and so on need to create those opportunities. Next, please. And on the same type of vein, one recommendation where one can be actively involved is to always choose the travel routes that minimize near road air pollution exposures, and you try and avoid roads with traffic. And of course, it's all very easy to say this, but again, you need to have ways in which this can be done. And one of the ways in which this can be done in London is to use this app, which is available free of charge from the Mayor of London, using this app called the Clean Air Route Finder, where you can log in and say you wanted to go from A to B, and it will tell you what's the way for the least exposure to pollution. And of course, this app will have up-to-date information about the level of air quality on each road and so on. And so that could be useful. Next slide, please. The next recommendation was that you should moderate outdoor physical activity when and where air pollution levels are high. And this is a very important piece of information. So really, when the outdoor pollution is high, you should moderate your physical activity. And this doesn't prevent you from doing physical activity, because you recognize that physical activity is a very good thing to do. And I've shown here one of the reasons why we think that should be done is shown on this slide here. Professor Wong already shown you this these results of asthmatics that we took on Oxford Street versus Hyde Park, and the effect on FEV1 on their airflow obstruction. But while here, what we're showing here is a recent study. A couple of years ago, we went again to Oxford Street, and we took with us some healthy subjects. These were healthy subjects, 60 plus. So you can call them elderly ones. I'm an elderly one. I didn't take part in that study, but in that study, we showed that if you walk in Hyde Park, your FEV1 improves. And this is, in fact, a very novel observation. So this is one of the benefits of walking in a park which is not polluted. Your airways open up, your airway tubes open up and eases the breathing. However, if you do the same thing on Oxford Street, you will see that you lose, more or less lose this, this benefit of walking. So this is the reason why this recommendation has been made. Next slide, please. And then the monitoring of air pollution levels. So you can see that the evidence grade D here is not as good. It is, in fact, evidence based on the four experts that wrote this paper. However, we can see the benefit of this. And there are now gadgets that you can wear that can tell you your exposure, for example, to the various particle matter as you go around doing your usual daily activities. And that's important because there could be two people living in the same house, but because of the way in which they lead their life, one may drive a car, one may cycle to work, their personal exposure would be different. And I'm just showing you an example here of these monitors. In fact, these monitors sends information constantly to the cloud through the portable phone, the mobile phone. And this is a lady here who's wearing this and walking on a very polluted street in New Delhi. And you can see by the color of those dots here, there are certain areas where the level of pollution where she walks is extremely high. This could be at intersection of streets, or there may be a source of pollution by the roadside that makes it very high. And knowledge of this personally would help you, as I mentioned previously, in avoiding those areas and also taking other measures. So that's probably going to become an important part of personal strategy. Next slide, please. And the same thing, I think, applies to indoor environments. Now we're recognizing the indoor environment can be very polluted, and so it would be good to know what are the levels inside, and if they're high, certainly using portable air cleaners that are available now. Again, this is an evidence grade C, which says that these measures do work, and therefore you would expect that if you reduce the level of exposure indoor, and let's remind everyone that certain people do spend a lot of their time indoors, that would be helpful. Next, please. So these are some of the personal recommendations. Now, what about the effect of modified interventions to modify individual risk factors? Next, please. So obviously, I've already mentioned this as doctors, as a doctor myself, a respiratory physician treating people with asthma or COPD. It's very important for us to maximize the treatment of those people with those conditions, and also it's important that we teach those people how to treat the asthma or bronchitis should the asthma or bronchitis gets worse during a high pollution days. I won't go into this, but the principle would be to increase certain treatments, and if that doesn't work, obviously they need to get acute help from either the hospital or from the doctor. And obviously there are other things that is important here, is the promotion of primary, secondary, and tertiary interventions, such as reducing obesity, promoting physical activity, smoking cessation, and avoidance of secondary hand smoke, etc. Next slide, please. I think one area where we do get a lot of questions from the public or from our patients, and I'm sure as pharmacists you probably have been asked those questions about, whether you should be taking any supplements with antioxidants, anti-inflammatory agents. And our recommendation, in fact, this is evidence grade 3, this is specialist evidence, is that we do not recommend any dietary supplements specifically to counteract detrimental effects of air pollution on respiratory health, as none have been shown convincingly to have such benefits. But it is important that everyone does have a balanced diet, by which we mean a diet rich in antioxidants, fibers, protein, polyunsaturated fatty acids, like you get when you eat fish, particularly, or salmon. It's a sort of what we call a Mediterranean type diet. And here I've listed some of the sort of supplements, vitamins that have been considered, and some people I know do take it, but there have been no controlled studies. It might be worth perhaps mentioning that sulforaphane, which is contained in broccoli, is well known to be, for example, a good antioxidant in various studies, but have still not been shown in controlled studies, human studies, that this really is preventive or prevent the effect of the pollutants. So there's still a bit amount of work to do here before we have any specific recommendations in terms of supplements. Next slide, please. So really, this is really a summary of what I've already gone through. And what I want to really end up with is about talking about pollutions at elevated risk. Next slide, please. So, so I've already mentioned children, older people, pregnant women, particularly for the fetus, and also those with cardiovascular disease or respiratory disease. And and of course, there are communities that live near polluted places, near main roads, and in fact, we do know that those communities very often are the poorer section of the community. So these people are obviously at risk. And the question that I have is, can we, in fact, at a personal level, detect who are those that are at particular risk? I mean, we know that 7 million people in the world died as a direct consequence of pollution. So it doesn't mean that everyone will die. But what we need to do is to pinpoint who is that individual who is likely to die. And this is, in fact, the research that I'm very deeply involved in. And this is a very important issue, because some of you may have heard that last December in the UK, there was the first case of an asthmatic has been legally confirmed to have died from a direct effect of pollution. So on her death certificate of Ella, who was that girl who died at the age of 9 following a severe attack of asthma, has been considered to have died directly of the effect of pollution. So could we have predicted that Ella would have died from pollution? I think we should have, because she was an asthmatic and she was living on a very busy London street with high levels of pollution. And I think that was enough probably to say that measures should have been taken to prevent that death. So that's why it's important. For the next slide, please. So finally, I think pollution represents a really big opportunity for us as health professionals, because obviously it is a very important health issue. And we know that this affects everyone, as I've said, and we health professionals do have a duty, I think, and we are willing to play that part, and if not, also to be champions for fighting against pollution. So, in order to do this, it's very important for us to really learn a lot about air pollution, what is the effects, and learn about some of the measures that we can take to mitigate the effects. And also, as I mentioned, I mean, if some of us could be champions in fighting for cleaner air, that would even be great. So I hope that my presentation has been helpful in engaging all of you in the fight towards this big problem that we have of air pollution. Thank you.
Thank you, Professor Chang, for this comprehensive talk which emphasized the importance of this topic. I mean, the air pollution, which have impact on health at all ages and all conditions. And also we discussed how pollution might exacerbate other diseases and infection. This is very important. And also the talk highlighted some clinical, pharmacological and non-pharmacological treatment, including preventative measures available to minimize impact of air pollution on health. Actually, we would be very grateful if you can provide us with the paper that you discussed, which discussed the preventive measures. And also, I like the idea of the application, which show the roads with less air pollution. I find it very interesting. Now we will have a chance for questions and answers. So please, if you like, type your questions in the question and answer box, please. If I may ask Professor Young, how likely is it for us to see increasing pressure on healthcare resources due to the air pollution? And how can pharmacists play a part in reducing this pressure?
Now, of course, there are two major problems very often I think community pharmacists would face. In light of air pollution, very often patients, whether they have upper respiratory disease such as allergic rhinitis, or patients with lower airway disease such as asthma. And the evidence is very clear that these two groups of individuals, actually, they tend to have more symptomatologies, all right? So as Professor Chong earlier mentioned, for those particularly with a nose problem, it's kind of a lot of the pollutant, they get deposited in their upper airways. Or if there is people advising them, there is regular cleansing and regular nasal hygiene, that would reduce the contact time between the pollutants as well as the nasal mucosa. That would probably reduce the inflammation. And now, patient with an airway disease is very interesting. Very often, when we see patients with asthma, for example, a big majority of them, they also have rhinitis problem. And evidence is very clear that, for those with both upper and lower airway problems, if the upper airway disease is not well controlled, it tends to activate the immune system, such as the lower airways would be more difficult to control. So in other words, for asthmatic with allergic rhinitis, if there are a lot of irritant and pollutant get deposited in the upper airway, resulting in more severe upper airway inflammation, they will have more severe lower airway inflammation. So I think for pharmacists, if there is a good knowledge of the locality about when and where air pollutant are particularly high, we can advise our patients try to avoid exposure. And for those, sometimes exposure is very difficult to avoid 100%. So they may want to do some regular hygiene of the nose in order to reduce pollutant in the nose.
Oh, thank you. Thank you. Professor Chang, is there a link between poor air quality and worse health outcomes from COVID-19? Since we are in COVID-19 era.
This is I was just going to mention this, and thanks for introducing this. I think there's been. I mean, one of the things that we've learned during the pandemic, and is that the outcomes from COVID-19 infection seem to be worse in areas of high pollution, and particularly in the US, that would be inner cities, and also this was reported in Italy during their last spike in northern Italy, and of course, this means that well, the explanation for this could be that the inflammation that's caused by the pollution makes the infection worse. So if the infection gets into the upper airway or lower airways of a patient who's been exposed to pollution and therefore have a lot of inflammation, then the virus is much more vicious and causes much more damage. The other possibility is that the virus may travel on the particles, and therefore you inhale it directly up either in the nose and also lower down the airway. And this is something that I think is a high possibility which we're looking at. And it would make sense very much to use your nasal wash, I think, which would also presumably wash both the pollutants in the nose and also wash off any virus. And I think this is something that there has been some studies being done on that, but I'm not aware of the exact results.
Interesting. And now for both our professors, do you think interprofessional cooperation is crucial for managing air pollution? And how do you see the interprofessional interaction should be like? If we have to make like an action plan, at the end of the day, we are looking for the patient or the individual as the center of our care. So what do you think about the interprofessional interaction, being a pharmacist and yourself as a physician?
Gary, would you like to kick off?
Oh, I'll tackle this. And of course, I mean, for a huge problem like air pollution, on one hand, of course, various government agencies, they have a very important role in, formulating both short-term and long-term policy. But of course, those things, we're not going to change air pollution overnight. I mean, this is a huge problem and it requires a lot of cooperation among different departments. But for us within the healthcare sector, we must work together. On one hand, the researchers and academic physicians may research out the mechanism and also the ways to reduce the detrimental effect of air pollution. But of course, many of these, it's not going to be a pill that, once you take the pill and then you're going to be resistant. A lot of these are, physical measure or cleaning measures that actually the physicians would require, community nurse and community pharmacists to spread the, knowledge. Because traditionally, I think, very often, particularly, for example, in pharmacists working in the community pharmacy, they may not know that they actually have a proactive role of educating patients. So if we can spread the information that we learn from the research so that everybody would take part in taking an active role in informing patients what they can do, I think very often you will find patients, they may not, with a little bit of irritation in the nose, they may not go to see the doctor, but instead they would end up in the local community pharmacy and ask, oh, I have this nose problem, it could be related to air pollution, what should I do? The pharmacists will have a huge role. So cooperation among different members to me, I think is very important.
Thank you, Professor. Professor Chang, in your opinion, which preventive measures or management solution has the greatest impact on health from the ones that you've been mentioning all the time?
Well, I think there are two ways. As I mentioned, I mean, the first way is to, at the personal level, you find out how much pollution you're exposed to and try and reduce exposure to pollution. I mean, this is not easy to do. It will need, knowing the pollution level to the areas you go to, and very often it's difficult to avoid this. But I think this is one of the first things one needs to do personally, and there are ways, as I say, to mitigate to reduce the levels in your home if it's very high, and for example, I mean, in many countries, people still use fossil fuel at home to cook and so on, and that needs to be replaced. And I think there's been a lot of work on that. So, and in terms of the other things that you could do, which are probably not related to taking any particular tablets or supplements, but as I mentioned, I mean, make sure that you have a balanced diet. Make sure that you do exercise. I mean these are not specifically for pollution, but but would help to reduce the effect of pollution. Stop smoking, prevent secondary exposure to cigarette smoking. Well, let's face it, cigarette smoking is still very common in the world. And that's another important source of pollution, both in the home and outside. Yeah, that's right.
Thank you.
So and again, and if you do suffer from allergies, asthma, and bronchitis, you need to get those treated as best as possible.
Yeah.
And of course, one of the things that we need to consider, I mean, against to reduce the level of pollution, I mean, what can you do if you do live on a very busy road? I mean, most people would probably not be able just to move away and to a presumably much more expensive area, because the more expensive areas are those that are far away from the main road. So there's an issue there. So finally, basically, there need to be measures taken at the governmental level to reduce the source of the pollution, which is about electric cars and so on.
Thank you, Professor Chang. Maybe this is the last question for Professor Young, because we are short of time, and then we need to wrap up. Professor Young, people in some countries where outdoor air pollution is not visible are of the notion that air pollution does not exist in any form in their environment or affecting them in any way. What do you think is influencing this thought?
Well, humans are very visual oriented. When you see the things, it's it's kind of bad for you, the particles. But in fact, in many developed places and also indoor environment, a lot of the pollutants actually are invisible. For example, if you talk about various types of gas, such as nitrogen dioxide, in the home environment, various volatile organic substance, or volatile organic solvents, and so when you don't see it, and you tend not to think of it, but the research evidence are very clear that when these components increases, the asthmatics and those with airway disease tend to do worse. So I think we must educate people that it's not that, in California, when you see the smog and then it's bad for you. There are a lot of places, as we, in the earlier video, we show across the world, a lot of countries, even in many European countries, in the indoor environment, actually the the levels of air pollutants are quite high. So when they're invisible, actually, it's even worse. You don't think of it, and then it may cause more long-term harmful effect to our health.
Yeah, thank you very much. Both of you, you did very nice presentations. Now, maybe you have a task to do, is that to answer the rest of questions in the Q&A box, please, if possible, because we are short of time.
Right. I tried already. I answered quite a few of them.
Yes, and we noticed. Thank you very much for that, Professor Young, and
no
also
problem.
Professor Chang. It was great presentations. So to wrap up, I think just a few words. As pharmacists are uniquely positioned to triage and manage individuals with respiratory illnesses and symptoms, such as those suffering from asthma or COPD, they can improve patient health outcomes by enabling timely diagnosis by early screening mechanisms, optimizing medicine selection, and providing education and counseling to patients, and maybe referral when needed. Not only that, but also they can proactively inform and support patients in adopting preventative measures against air pollution so that they can breathe better. Expanding pharmacist knowledge and skill set in the area of air pollution with its negative impact on health can lead to increasing public awareness on air pollution, mitigating short and long-term impacts of air pollution, and ultimately improving respiratory health. It is imperative that health system and healthcare professionals work in synergy to mitigate the impact of air pollution on people's health and quality of life. In this webinar, ways in which outdoor and indoor air pollution impacts human health was identified. And I believe the attendee had more information in relation to the short and long-term impact of air pollution on health, as well as some clinical, pharmacological, and non-pharmacological treatment, including preventive measures available to minimize impact of air pollution on health. And also the webinar provided information indicating how air pollution might change the type of professional services offered by pharmacists. By this, we thank and look forward for your participation in our upcoming webinar entitled Community Pharmacy Roles, Services, and Tools to Minimize Impact of Air Pollution on Health. That will be held in the 12th of August, 2021 at 13 to 14:30 CEST time. Thank you very much again, and looking forward to seeing you in more engaging webinars as the one that we have today. Thank you very much.
Thank you.
Bye-bye.